Brushlink is on a mission to be everyone's personal dental coach. They offer smart oral care solutions and a custom data ecosystem for patients, dentists and insurance companies. Their solution combines data with technology to help prevent tooth decay and gum disease. In this next session, find out about how consumers can be helped to improve their brushing behavior and oral health care, thus helping insurers to reduce costs.
Hello everyone, I am here I'm just going to let you guys introduce yourselves. I'm going to start with you.
Yeah, hello, I'm Raymond. I am a health insurance solution leader within Philips. So Philips is a health tech company. We're very focused on consumer innovation, health tech innovation, and I focus on our health insurance solutions.
Hi, I'm Lena Pierre. I'm the new business lead for Western Europe at Philips. So looking at new business models and working with insurance companies on healthcare solutions for women's health.
Hi, my name is Nazar Kamangar. I'm CEO of Brushlink. Brushlink is IoT and software service for brushing habit.
Seeing as I'm a last-minute replacement, I hope you can excuse the fact that I'm going to be reading off my phone a little bit. I'm just going to ask all of you, can you explain the current status of the medical dental integration of digital records in 2023?
Well, we are pretty early as far as the medical dental integration. I think probably this is one of the very first topics that we're talking about medical and dental. Mostly it's because of the digital record issue that doesn't exist today for the dental. And secondly, I think everything starts with our mouth, right? But for so many years, oral health was not part of healthcare when we talk about healthcare, right? Diet, healthy lifestyle, overall health really start from our mouth, right? So the integration is extremely important, especially for the insurance companies, because we see there is a lack of digital data for oral health. I don't know, but what's your take on that?
Yeah, no, I think I agree, right? So we always say the mouth is the gateway to the body. And I think a lot of people still are very unaware of the links between oral health and other systemic health issues. And there's a lot more education and awareness that needs to happen. And I think, we are getting better at the digitalization process between, the dentists and also insurers, hospitals, others. But it's still fairly early on in the adoption.
Yeah.
No, absolutely. If you look at your overall systemic health, oral healthcare is such a big portion of that. If you look at the top conditions when we talk about insurance, diabetic issues, cardiovascular issues, then oral healthcare is such an important part of that as well. So you're way more likely to develop cardiac disease if you have, for instance, periodontitis. So having a good link between your overall medical records and then also your dental records just adds also a lot of simplicity and seamlessness in that journey. So if you see your own doctor, if you see your dental professional, it is important, it's crucial even, that they both have access to the same information. So that is something that I think the industry really needs to start adopting much, much further.
Are there any initiatives in that direction at the moment?
For us in Brushlink, we started with centralized digital record for oral health, which is integrated with the smart toothbrush platform as far as the data and analytics goes. The platform called ICU Patient, and basically this is the starting point for collaboration between the physician and dentist. So let's say if you have a cardio patient, if you have a diabetic cancer patient, it's really important to know about the brushing habit, have the access to the digital records. And we see there's a lack of the communication between physician and a dentist, right? And then a lot of it is because data is not available, right? We need to have the data.
Yeah, I did an episode in the Digital Insurance podcast recently speaking about the current trends in the insurance industry. And one key trend for the year 2023 was parametrics. How do you think the insurance industry can benefit from dental-driven parametrics? Maybe for all of you.
Well, I guess the missing part right now is the baseline, for the status of the gums, for example, right? So we go to clinic twice a year, or hopefully everybody goes. Most people don't get like the perio chart, right? What's the status of your gum? Is that deep pocket 5, deep pocket 6, deep pocket 4? How is that improving, right? So for the insurance market, for the self-funded employers, and even for the consumers, because I don't think anybody is having the full cost of the dental work 100% covered by the insurance market, right? So everybody's trying to figure out, how am I going to save, right? And the saving is really coming by education and prevention, right? And that is a process that we have to take to educate people how you can, save on the cost if you learn how to brush, if you learn how to save your teeth so you're not going to get to implant, to lose your tooth. So for the insurance market, I think the most important part is finding data ecosystem that can work, and you have access to that, which is going to be standard data, not any type of data that every data is different from other data, right? The same data for the dentist, for the hygienist, for the physician, for the insurance market, and anonymous data for the employers. So they can incentivize the employees, they can incentivize the members to brush better, because that is going to impact on your overall health.
And I can give an example. So we ran a program last year with a leading insurance company in the Netherlands, and this is the first time we've really been looking at brushing behavior and data. So obviously we can measure 3 different types of data. We're looking at duration, how long are people brushing for, frequency, are they brushing twice a day? Everybody knows they should, but not everybody does. And we also look at coverage, which is such an important feature of actually where in the mouth are people brushing, or where are they missing, most importantly, because often people will miss the same spot. So apparently if you keep doing that over and over again, that you can develop cavities and other oral healthcare issues. So we're measuring these 3 key factors with this insurance company, and then linking to actually what does that mean? So if people are brushing correctly, so 2 minutes twice a day, can we reward them? So can we give them free brush heads or something? And we see actually by giving that reward, people are willing to participate, to share their data, and also to brush compliantly, and this is really fantastic. So over the course of the year, we actually saw an improvement in less number of dental claims, and overall dental health as well from the dentist. So we also linked it back to, did the dentist see an improvement in their dental health? So yeah, it was really positive to already see that link with insurance.
Absolutely.
I think if you look also at the future, so we already mentioned dental care, dental habits are incredibly important when you talk about overall systemic health. I think we're still very much at the verge of understanding that connection truly. So, for instance, what is the impact of your dental health on issues like diabetes, on cardiac issues, and so on? We don't fully understand it, but we know there is a link. I think once we start to build up more data about those comorbidities, we start to also understand really the connection, and from an insurance perspective, that is so incredibly important in the underwriting process as well. To really understand, so let's say there's 3 layers of data. There's the pre-existing conditions that somebody might have, their upbringing, their genetics. There's the brushing data that Emily and Nazar were talking about, and then there's the outcomes. And I think that as a holistic circle, we don't have yet the integrated data of how that works. And especially now we're starting to collect more data through connected devices, smart devices, but then also integrating to Nazar's point further with your medical record. we will start to really unveil, okay, how do these conditions interact to make much more meaningful advice also towards consumers, dental professionals, and so on.
Well, you said something earlier in a conversation that we had in the back there. You mentioned the importance of parametrics and dental parametrics specifically for pregnant women, which was something that I didn't know beforehand. Maybe you can explain something about that.
Yeah, well, absolutely. So very few people would know, and it doesn't necessarily make sense. We spoke about this on stage yesterday as well, but during pregnancy, about, let's say, 60 to 75% of women develop a condition called gingivitis, which is a precursor to periodontitis, and as a result, they're way more likely to develop either a preterm birth or have a preterm birth or have babies with low birth weight. So that is a very harsh connection, because obviously when you talk about dental health, you don't talk about the health of your unborn child. But there's a strong connection, actually. And it works all the way through bacteria in the mouth, and actually not a lot of people still understand that connection. It's not that well known yet how that works. But the data does show, we actually ran a study for about 12 years in the state of Virginia, so a very long study to understand, okay, how does dental habits impact pregnancy outcomes? And we saw when we supported people with better pregnancy support, better dental habits, so we provided them a Sonicare toothbrush, gave them guidance on how to brush their teeth, we saw a reduction of about 30% in preterm birth. And that is massive. And then if we bring that back to the insurance space, this is very US specific, but the same goes for Europe. A regular full-term pregnancy is about, let's say, $15,000 in cost in dollars in the US. But a preterm birth is anywhere between $45,000 to $150,000. So then automatically you see that coming back also into the insurance space, like, okay, dental habits make a lot of sense during pregnancy. It's something that we should be promoting. The other thing that is still connected to that is that during pregnancy, not a lot of women are guided in how do you properly brush your teeth, or even that their dental professional will talk to them about it. So there's still a big gap.
I also would like to add, it's not just during the pregnancy as a mom. A lot of women do have, depression post-pregnancy, right? And then mental health is also correlated with your brushing habit. So if you want to look at the next generation, about the children, the education has to come from mom, right? So if mom is really taking care of their dental hygiene, then you expect the children to be healthier, the children learn how to brush, right? So the topic of medical dental integration is also going to include mental health, right? Because that's part of it. And then brushing habit and lack of the hygiene is going to impact on your overall health and on your mental health in general.
Yeah. And how do you think insurance companies can benefit from that?
I think the starting point is going to be like smart toothbrushes. Raymond and Emily had a great presentation yesterday about the state of the women in general, children and adults. And I think companies like Philips, for example, that are in the intersection of healthcare and dental care are going to be extremely a big player as far as what we are trying to accomplish. Companies like Brushlink that are in the data section, and they're trying to bring the standard data like a plug and play to the insurance market. They're creating ecosystem that this ecosystem can help insurance companies to have full productive. And at the end of the day, if people have less cavity, if there's not going to be root canal, if there's not going to be gum disease, that we know about 3.5 billion people around the world are suffering from gum disease, that's a cost saving, right? And in addition to that, it's going to be school productivity, right? So kids are not going to go out of the school. For employers, it's easier because then nobody's going to take time off to go for, working on the expensive procedures for the dental. And in addition to that, there is absolutely no dental insurance company that I know that is going to cover 100% cost of the dental. So at the end of the day, it's everything. There is something for everyone, I'm trying to say, as far as the benefit goes.
Speaking of gum disease is a big problem with seniors as well, isn't it?
So gingivitis or perio in general is going to come from the poor hygiene, right? So, and then if you really take care of your brushing habit, if you learn from the early ages, which in my opinion, it's best to start from children, right? So when we get to the seniors, for example, it's hard to change the habit, right? But incentivizing the children is going to be great. Like, for example, if the kid is brushing better, then mom and dad can give them, reward. That can also work within the insurance company, right? So we want to solve a massive problem for the gum disease that exists today. And this problem is not something that happened today. This problem was happening because of the behavior of the consumer, right?
Yeah, and it's not like everyone, knows what they should be doing, but they just don't do it. And that goes back to how do you connect through smart toothbrushes to actually, so people can track themselves. How are they brushing? They hold themselves accountable. You link that to insurance. They get rewarded for doing healthy behaviors. And we see that very much in the fitness and lifestyle space, right? People doing 10,000 steps, linking it to the Apple Watches, but we haven't yet really connected that to dental health. And I think you made the question on, why is this interesting for insurers? Well, you look at the top 5 diseases, which is causing most of the cost. Actually, 3 of those can really, there's preventative measures in oral healthcare that can help to manage or, to reduce some costs later on. And the earlier we do this, the better and the higher impact that's going to have. So, of course, if we can get kids brushing correctly, using an electric toothbrush ideally, because we know that's so much better for efficiency, then through their life they are hopefully likely to be more healthy as well. And when it comes to seniors, obviously manual dexterity is a big issue as well. So not being able to have as much flexibility or arthritis to be able to brush correctly. So using simple things like an electric toothbrush can still get that brushing to a correct standard. So it's using the right tools, the right digital tools, but starting as early as possible and preventative is really the way to make the biggest impact.
From a customer perspective, though, if you look at telematics, for example, in driving afterwards, me as a customer, I can then see how I have driven a specific route, for example. Was I a good driver? How is that with smart toothbrushes? For me as a customer, what do I see?
Well, it's all about insight. And I think most of us, when we have our dental checkups, you'll have that one moment where your dentist says, well, hey, think about that one spot there in the back. You might be missing out on that. But like Nazara was also saying, you have that checkup perhaps twice a year, once a year. But in the meantime, who's helping you to know where have you been brushing well and how are you doing that? So giving that insight is one of the most important things that we can do. So making sure that people brush their teeth at least twice a day for the full 2 minutes. But also with connected devices, we're able to show you actually missed that spot and you do that recurringly. And that's something that most people are not aware about. So really helping them to also solve that. It's not about necessarily having continuously a dashboard of how you're brushing your teeth. That's not that interesting. But it's that one instant where you think okay, I do need to think about that a little bit more. That's going to, prevent tooth decay in the long term.
I like to add something to that as far as the consumer goes, right? So we spend a lot of money every day on different things, right? But brushing is supposed to be 2 times a day, right? So in general, let's say if you're spending €1 a day, right? $1 a day on our brushing habit and something that we're using 2 times a day, it's not that much if you really take a look at that. But that is going to have a huge cost saving for the consumer down the line that they're not going to have expensive procedures, because everything is going to go back to education, to communication, to prevention, right? And in my opinion, insurance companies or employers can offer smart toothbrushes as a service, right? So you can offer, for example, Philips Sonicare to the employees, to the members on a 2 years basis. Every 3 months they have to change the head, and that's going to work much better than a manual toothbrush. Even though like Brushlink is offering like external device for the manual toothbrush, I personally am a big believer of a power toothbrush, and I think that's the future, right? We want to improve brushing habit, and basically that's the opportunity right there for the insurance companies to offer smart toothbrush that people have the access to the metrics. They know how they brush, and parents know if your child really brushed today or not. You know, that's important to know.
Yeah, and I think you made a good example, right, with you have those, when you're driving now, the box is fitted in, right? So if you drive safely, you pay less on your car insurance every year. So this has become now, part of how car insurance is. But actually, when we look at dental insurance, well, what about if, you're constantly brushing well? Should you not be paying less on dental insurance? You should be rewarded for brushing correctly, sharing your data. And I think, we know that when we look at app usage, people will tend to, use the app for, say, the first couple of weeks or a month, because people think they know how to brush, but actually it turns out, once you're following it, you realize, oh, maybe I'm not doing it exactly the right timing per quadrant, or, things like that. So it's learning how to do it, and then having the app on your phone where the data is just being sent, right? So you don't then have to keep looking at it, because we know a normal person not every day is going to be using that app, which is fine, right? Because once you've learned the behavior, it's just about reminding yourself and checking in. It could be once a week, once a month, however long you need that, to see, am I on track? Am I doing what I need to be doing? And linking that, if it is to an insurance policy, to say, am I going to get my reward at the end of the month or the end of the year?
Yeah. Also, I think when we talk about this, a very big portion of that is behavioral health, right? So we're talking about trying to influence people in their brushing habits, which may have been ingrained for a very long period of time. What I like with what Brushlink is doing, it's really lowering the barrier of helping people get insight in a very simple way in their own brushing habits. And that is so important. On our side, one of the things that we do, for instance, with our Sonicare for Kids, we have a very simple, but it's such an amazing app that kids can use to start brushing their teeth properly, and they get rewarded in the app as well. There's this animated character, and it's, well, my kids, I've got 2 kids, both of them, they love it and they like brushing their teeth now. So removing that barrier is incredibly important by lowering the cost, getting, for instance, your toothbrush or your connected toothbrush co-paid by your insurer. That really helps. Having the right gamified incentives, rewards, an immersive experience, the right insights, all of those things need to come together.
Yeah, I think that's the correct keyword. It's the gamification of the parametrics so that you can make it enticing for children.
Absolutely. Absolutely.
Very interesting. So we've talked about the consumers, we've talked about the insurance companies. I've got one question here that I'm looking forward to the answer of that. How can the government, or how can governments benefit from medical dental integration?
Well, let's say in the United States, for example, since 1965, there was no changes in Medicare for the dental matters, right? So we see the aging population, that the seniors, for example, they don't have the dental insurance. One of the issues that we see in the US specifically is because people don't have dental insurance, they go to ER, to emergency room. And there is over $2 billion a year spent on the dental emergency that really we can avoid that, right? So on the other side, most of the governments around the world, they cover for their children until 18 or 21 or something like that, right? So if we start teaching the kids from the elementary schools, from daycare, how they have to brush, right? There's going to be a cost saving over there, because it's around like 50% of the kids, when they get by the age of 7, 8, they have at least one cavity, right? That can be prevented and that's going to be a cost saving for the government, right? So in the ecosystem that we are proposing, I think government and insurance companies and employers are part of that cost saving process, and that is going to be a change management that I would say from what we're proposing today compared to what happened in the past 50 years ago, because oral health is not technically part of the healthcare, and we're trying to integrate medical and dental together.
That was very, very interesting. Emily, Nazar, Raymond, thank you very much.
Thank you so much for having us.
Thank you so much.